Today on the Dr. Steve Show, you or a loved one might not have Parkinson's or Alzheimer's. Find out why people are being misdiagnosed and how they can be cured of symptoms.
This is Dr. Steve. Feel inspired.
This show is going to change your life.
Feel connected. Feel better.
Feel better is not just a slogan for the show. It's actually a challenge, a mission, and a promise from me to you to help you live a healthier life.
This is Dr. Steve.
Hi, I'm Dr. Steve Salvatore. Thanks so much for joining me today. We're going to feel a lot better and be a whole lot smarter after today's show. Up front, it's heartbreaking if you or a loved one is diagnosed with Parkinson's or Alzheimer's disease, neither of which is curable. But what if that's a misdiagnosis and you don't have Parkinson's and you don't have Alzheimer's? Instead, you have a different brain disorder that actually can be cured. Well, joining me now is Dr. Adam Mednick and one of his patients, Hudson Peel, along with his son, Mark. Welcome, guys. Good to see you.
Thank you. Thank you for having us.
Now, Dr. Mednick, you wrote a book called NPH From Diagnosis to Treatment. First of all, for our audience, what is NPH? People don't even know what that is.
Well, let me just start off by saying hydrocephalus means excessive fluid on the brain. And with the condition called normal pressure hydrocephalus, what happens is that if you can measure the pressure, like for example, doing a spinal tap, inserting a needle into the lower back, when we check the pressure of those individuals, it tends to be normal, hence the name normal pressure hydrocephalus.
Yet you still have the condition hydrocephalus, which is going on, so it can be a little bit tricky.
Correct.
So why the misdiagnosis? Why is this happening? Are doctors just not aware? Are they not doing their job? What's happening here?
Well, I think the big issue is the fact that NPH can resemble Parkinson's disease and Alzheimer's disease. And when patients come to the doctor, oftentimes they come because they have trouble walking. And since NPH is such an unknown diagnosis for a lot of doctors, it's easy to say this is going to be Parkinson's disease and treat it as such. But the key now is what happens after the trouble with the walking begins. So that's the second symptom, and that's where doctors get hung up, and that is not asking about urinary incontinence.
Urinary incontinence, which a lot of people have, and a lot of doctors even kind of just don't go there, right? They kind of dismiss it. They don't talk about that part. So you got to get over that part and get past it. But Hudson, I want to ask you for a second. When you first went to the hospital and they told you you had Parkinson's, what did you think about that?
I didn't really know what Parkinson's disease was, so I didn't really think much about it.
All right.
I was just glad somebody had finally found the name of what I had, because I had gone for over a year with nobody telling me what I had wrong with me.
Okay, so they finally, the misdiagnosis was there. But Mark, you were with your dad, and he had difficulty walking. We have some video of someone with NPH, and this is not your dad, but I want to show that. Watch this incredible video. This is someone with normal pressure hydrocephalus, and they have the classic, what we call ataxia, difficulty walking. Now, when your dad was actually in a wheelchair by the time he...
Oh yeah, by the time he saw Dr. Mednick. But that's exactly the way he was walking. He would stop, couldn't pick up his foot, then he'd have to rest, and then he could go a little way and then stop. So it was a little worse than that.
Right. Then eventually we have a video of this man being treated, and we're going to talk about that in a second. But here, there you go. Look at that. I mean, 6 months after being treated for normal pressure hydrocephalus, which is pretty incredible. So back to you, Dr. Mednick. How many people do you think are in nursing homes right now that might have this condition, and people think, well, you know, they've got Parkinson's or they got Alzheimer's? What percentage? It's just a guess, or do you have a hard number?
Well, we estimate about 400,000 people in the United States have NPH, of whom only 11,000 have been treated with a shunt.
How do you treat this condition, and is it difficult to treat?
The imaging studies, for example, the brain CAT scan, MRI, those are the studies that we start with first, and then we do a spinal tap, and then oftentimes just a regular spinal tap, meaning we just take off a certain amount of fluid. We may not see improvement, but if the suspicion is still there, and then what I would do is refer the patient to one of my neurosurgical colleagues who can actually admit the patient and do what's called an external lumbar drain, where you can have continuous removal of the fluid in the brain.
And then you can start to see an improvement of the symptoms.
Correct.
And then definitively, spectacular improvement. And then eventually, though, you have to keep that fluid off the brain. So the
Correct.
Definitive treatment is a shunt, right?
Correct.
Explain quickly what that is.
Well, what it is that, like for Hudson, for example, the procedure is done under general anesthetic in an operating room. And the surgeon will make a small hole the size of a dime in this area right here, and he will insert the catheter in through the skull into one of those ventricles that contain the cerebrospinal fluid. And then there's a shunt that sits underneath the scalp. He can't feel it. And there's a tiny little rotor that actually helps to siphon out that fluid. There's no batteries. And then on the other end of that catheter valve, there's another valve that comes under the skin that goes down into his belly and drains off that excess fluid. So that's the treatment. It's called the shunt.
Yeah, it's a very common thing, been used for years. Neurosurgeons have been doing to take the pressure off the brain. Hudson, I have to ask you, how do you feel now, ever since you've been treated?
I feel great. I feel almost normal again.
Dr. Mednick, Hudson, Mark, really appreciate you guys coming and telling your story. And for those people at home, if you have someone that you think might have this condition, talk to your doctor. Go that extra step. Find out if they have NPH.